Now coming to the development of palate. Our palate. Okay. This palate is formed by the frontonasal process and the maxillary process. Palate its development can be described as primary palate formation and the secondary palate. Primary palate, P for primary and P for Panch. Secondary, again you write opposite second S, then it will convert into 8. So this is 5 to 7 week and this is 8 to 12 week. 5, 6, 7 इसमें 2 जोड़ दिए, इसमें 4 जोड़ दिए. ठीक है. Primary palate 5 to 7 week and secondary palate 8 to 12 week. Now primary palate is formed by this is our frontonasal process, we all know, and there is the pit develop, which later develop into a groove. Then there is medial nasal process and the lateral nasal process in the right side and the left side as well. Now these two medial nasal process get united and this will if we cut the section here, then this is, and here is the nasal pit, this is the united part, this is the united part, this one, and this is the lateral nasal process. Okay, this is the medial nasal process, this is the lateral nasal process. Okay, now this the medial nasal process of both side, it unite, and thus then there is posterior extension from this united both right and left medial nasal process. Now this whole of this, the two side medial nasal process as well as the posterior extension, this all together known as premaxilla. It is that part which will give rise to primary palate. And if I have taken section over there, then what we are seeing, this is triangular part. This is somewhat triangular, okay, having posterior extension. Now here is the maxillary process. We all know is the maxillary process. So here is the maxillary process. Now maxillary, there is extension on the inner side from the maxillary process. This is called palatal process. Palatal process of maxillary process. Okay, this both will unite in the middle, and at the same time here is our frontonasal process, and there is some part is suspending from the roof. Both of this is maxillary process, the palatine self of the maxillary process, and this is the united two side medial nasal process, and from the frontonasal process this is the hanging central part which give rise to nasal septum. But we are dealing with the palate, so these two unite to form the secondary palate. Okay, and there is also backward extension, like this, and this will come here and like this. This whole of this is the palatal self from the inner aspect of the maxillary process, which unite with the premaxilla and forms this is the primary palate and this is the secondary palate. Both will give rise to the whole of the palate. And as we know, this is the mesenchymal proliferation. This is the mesodermal, the frontonasal process, and the here is the from pharyngeal arch. This is the maxillary and the mandibular process has derived. So these are the mesoderm. So these mesoderm will get go into the intramembranous ossification. This will calcify. Okay. This will ossify. Okay. Intramembranous ossification will occur at this site. And the fusion occur. And this fusion progress from anterior to posterior. And there is a complete closure of this. But the intramembranous ossification of this palatal self and the premaxilla, this runs also anterior to posterior, but some part of the posterior will not go under the intramembranous ossification, and this will give rise to soft palate. So, our hard palate is developed from the primary palate and the secondary palate. Primary palate is developed from the premaxilla, which is developed from the fused right and left medial nasal process. Whereas the secondary palate is developed from the palatal process of the maxilla or maxillary process, palatal self of the maxillary process. And the soft palate is developed from the non-intramembranous ossification. Non-intramembranous ossification of the posterior part of the palatal self of the maxilla. This will get ossified, but this will not. And that's why this will result into the soft palate. But when we deal with the development of soft palate, we have to write that development of soft palate is from the first three pharyngeal arch, that is first, second and third pharyngeal arch. And we all know that the pharyngeal arch is developed from the neural crest cell, rhombencephalic neural crest cell, that is the nearby the hindbrain, and plus lateral plate mesoderm as well as the paraaxial mesoderm. This will give rise to pharyngeal arch, which is the up to first, second, third, fourth, fifth degenerate and the sixth pharyngeal arch. Okay. Now first, second, third will give rise to soft palate. From the first, it is no PPT. अपना PPT हम दूसरे को क्यों दें? Second is beware, कोई भी ले सकता है. Third, और तो क्या करें आप? ठीक है, just to memorize. So first pharyngeal arch will give rise to nasal and the oral epithelium of soft palate plus palatine bone and the palatal self of the maxilla, and T for tensor veli palati. No PPT. Nasal and oral epithelium, palatine bone, palatine self of the maxilla and the tensor veli palati muscle. This second pharyngeal arch give rise to taste bud over the soft palate. This is bud, taste bud. Third is or, that is oral epithelium of the soft palate, and R is for the rest of the muscle, that is the levator veli palati, palatoglossus, palatopharyngeus and the muscular uvulae. This way we can write. Okay. Now coming to the clinical significance. PET PMCH. PET PMCH. PET is the petechia, pemphigus vulgaris, migratory stomatitis, congenital malformation and herpangina. Petechia, पेट माना फंस गया है, कोई फंस गई PMCH में फंस गई, that is the fellatio, staphylococcal and the suction. These can be the causes of the petechia. Fellatio is the oral sex, and the PMCH, that is the pemphigus, migratory stomatitis, congenital. Now this is the primary palate. Here is the primary palate, and this is the secondary palate. The fusion is like a letter Y, and this is the non-ossified part, which will give rise to the soft palate. What sort of congenital anomaly can occur? As the fusion occurs from the anterior to the posterior aspect. So if some part remain unfused, then first it will give rise to bifidubula. Then if it is up to here, then this is the partial cleft soft palate. Okay, partial cleft soft palate. Then if this is not fused up to here, then it is total cleft soft palate. If this much is not fused, then it is partial cleft palate. Here we have to write cleft soft palate, but here partial cleft palate. Now if this much is not united and this also, then it is called the total but unilateral cleft palate. Total and unilateral cleft palate. If this also not unite, whole of the Y is not united, then it is called bilateral total cleft palate. Okay, so these are the congenital anomaly, and this is herpingina. Thank you.